rate and the direction of the change in blood glucose. Also gives you the graphs, and you can set alarms. And I believe with this one, you can also set predictive alerts. So before your blood sugar reaches the value that you have set your alarm, the system can even alert you that in 10 or 30 minutes your blood sugar is going to be that low. So another safety feature. This one checks the blood sugar every minute. So instead of every 5 minutes, you get one reading every minute on the screen. Now, I don't think that really makes a huge difference in terms of our management. Still, you need to, before making a therapeutic decision, you need to confirm it with your finger stick reading. The sensor, you can vary it for 5 days. So the cost is actually similar. The transmitter and the sensor costs between $960 to $1,040, and 6 sensors comes as a pack of $360 to $390. So 6 sensors is for 1 month of supply. So kind of similar, comparable to the other one, to the Minimed. In terms of calibration, the last 2 days of the sensor life does not need calibration. So only the first 3 days you have to calibrate it twice a day. And as we said, we have a built-in meter. This one only is approved for adult use. The third one is, with Navigator, as I mentioned, Cosmo insulin pump is kind of working in close relationship with Navigator Abbott. Dexcom is the third one. Again, the same main features: sensor and transmitter, and the receiver. It's much cheaper. I think the transmitter is only $450, and then because you have 7-day life for the sensor, so you need to change the sensor every 7 days, you just need 4 sensors for a month, and that's about $240. So it's a little bit, I think the cost is less than the other two. Reads interstitial glucose every 5 minutes. You can set alarms, you can get the graphs and the trend arrows the same, and you need to calibrate twice daily. And this one is also only approved for adults. Now, our clinical guidelines, what ACE considers the standard of care practice in 2007, tells us that a lot of patients who have unstable glucose control, who have not been able to achieve their target A1C, patients with postprandial hyperglycemia or nocturnal hypoglycemia, these are the patients that will benefit from either one of these systems. So I don't think that the fact that the insurance company might not cover it, that doesn't tell us that we should not use it. And in our patient population in pediatrics, if we have any of these indications, we try to appeal for it, and we try to kind of fight the insurances to get the benefit for our patients. And again, for us, only one of the pumps, one of the monitoring systems is approved for pediatrics. In adults, it's different, a little different. So, in summary, the glucose monitoring systems have FDA approval for the use in our patients. Unfortunately, they do not yet eliminate the need for finger stick glucose monitoring. So, we still need to check. If we want to achieve a target hemoglobin A1C, at least need to check at least 4 times a day, probably a lot more. Different devices all have the ability to provide on-screen real-time glucose reading. They show trend arrows, they show trend graphs, they have downloadable data that you can review and you can share with your provider and get that benefit. And also you can set alarms. And in the case of Navigator, you can also send predictive alerts. Last but not least, they bring us one step closer to closing the loop. So the very first insulin pumps in 60s were big and heavy, and this is our pumps, which is only about 100 grams. And we have the insulin pump delivery system, we have the monitoring system, and the monitoring system is able to talk to the pump. We just need to get this part right, the algorithm that will control the communication between the pump and the sensor, and then we would be able to get the loop closed, and the artificial pancreas would be available. I'm going to stop here, and these are some websites from this companies that make these devices. And I would welcome any questions or comments. Well, again, my patients are pediatrics, so most of them are type 1 patients and are taking insulin. So, and even though if they are not on basal bolus, even on conventional therapy, two injections a day, 4 times is minimum, if before each meal and at bedtime. Now, if I'm going to, playground, recess, swimming, things like that, if I feel low, I would check a lot more often. So our patients check a lot of times 6 to 8 times a day. But, the better picture you get from those finger sticks, the better you can adjust your insulin dose. And with pump, you have the ability to really, all throughout the 24 hours, adjust your insulin dose. So why not use it? But I have to have that insight. I have to know where my blood sugar is to be able to adjust my insulin dose. I cannot go blind. Well, as I said, it's not, I cannot tell you to change your insulin dose based on this alone. You have to confirm it. So if the system is reading for you 300 and you are going to take so with a blood sugar of 300, normally what happens is patient takes a bolus of correction insulin, right? Now, that cannot happen without checking the blood sugar. You have to get the finger stick, confirm that 300, maybe it's 280, maybe it's 340, whatever it is, and then take insulin. FDA does not allow us to take insulin with the reading on the pump. Hopefully soon we'll get that technology that, and I believe maybe in European countries you don't have that. But what we need to practice and what we need to tell our patients is you have to check your blood sugar. Yes, still. So my parents ask, when I tell them about the system, our patients' parents, a lot of times they get very excited. Wow, it sounds wonderful. You get the reading, then I don't have to poke her 6 times. No, you still have to, unfortunately. We are getting there, but we are not there yet. The other thing, as I said, the system needs that calibration. So if you don't enter twice a day at least, the system is not going to work. But it gets better. Maybe in a few years we'll get there. Okay, I think we are done. That's all I had to. Thank you. I left some handouts outside that will have all this information in detail. So.